record button. Okay, we're going to get started. Thanks everyone for joining. I think we'll have more people joining as we go along. There are about just under 20 or so people on the Zoom session right now. But let's get started. My name is Ramesh. As you know, we are the Thaarumaaru Runners. I've got my some of our runners on the chat as well, helping to moderate this session. And Naz are on with me. We are happy to bring this session to all of you, our runners. We've got Dr. Anand, who is an orthopedic surgeon, who's kindly agreed to spend an hour with us, speaking to us about common cycling and running injuries. Just a bit about Dr. Anand. He actually is a good friend of mine. We went to school together many years ago. In the army as well. We were in was it basic military training, Anand? Yeah, we were BMT. We did our BMT together as well, and we've kept in touch all these years. Obviously, he's gone on to be an orthopedic surgeon, and from time to time, I do give him a call whenever I'm having an ache or a pain or and so on. So he's recently joined the group. He's not been running. He hasn't run for some time now, but it may interest you to note that he's actually an avid cyclist. He's I think avid cyclist is putting it mildly. He's actually a very, very good cyclist. Covers fairly long distances on the weekend, and I think a couple of years back he did a time trial for on a bike, and I think placed amongst the top 10 cyclists in Singapore as well. So he's a doctor, but also an athlete.
Right, all the video off, right?
Yeah, by passion. Okay, that's a short intro to Dr. Anand. Those that have just joined us, can I just trouble you guys to have yourself muted so that there is no feedback or disruption as he's going through the presentation. Okay, so how it's going to go is Dr. Anand he's got a short deck of slides that he's going to be taking us through. He will go through that for about 20 minutes or so. He's got a short video that he would like for us to watch. That's about 8 to 10 minutes or so. So that'll be half an hour in total, and then we've got another 20 to 30 minutes to shoot questions. He's happy to take questions, field questions. I'm sure many of you that are on have come on because you have a question or two in mind. So we look forward to an engaging Q&A session. Okay, Doc, it's over to you.
Okay, thanks Ramesh for a nice introduction. Yeah, so and also thank you for Thaarumaaru Runners for actually coming on to actually listen to what we have to say today on some common running and cycling injuries. Yeah, so just a bit about myself. So I'm actually an orthopedic surgeon, and my main interest is actually minimally invasive foot and ankle surgery, and also sport surgeries. I am also a master cyclist with local race team as well. And currently I'm actually practicing in the Center for Orthopedics, and I'm based in Mount Novena, Kopi Hospital and Repertoire Hospital. A bit about my training. I was actually trained in Singapore as an orthopedic surgeon, and then I did 1.5 years of training in Switzerland as well. I had the honor of performing the first lateral ankle replacement in Southeast Asia. And if you want to find out more about what I do, you can always visit my website, anandaortho.sg, and my Facebook and Instagram pages as well. So something quite fond to my heart. I mean, it's I actually quite related to Thaarumaaru Runners because last year, before COVID hit us in 2019, I actually paired with Karthik and we did a relay event, a City 60 bike run challenge, and we actually came in first. So it's a really something memorable that I remember, and it was just before COVID hit, and since then we have not raced at all. So this was my last race actually, and it was nice that we came in first. Yeah. So without further ado, just start my presentation. Yeah. So we all have to start from somewhere. I mean, whatever levels of fitness that we have, we actually basically need to start from somewhere when we take on a fitness program or running or cycling. But something peculiar about running is that running actually produces about 3 to 5 times the body weight impact on every heel strike that we take. And for actually a 70 kg man doing an 8-kilometer run, this actually means about 1,300 tons of pressure. So as much as the engine room is your heart and lungs, you shouldn't be forgetting to take care of our chassis, which is our body actually. So today, my aim of the presentation is basically I want to talk to you about how you can actually optimize this body and chassis that you have and not let it be a limiting factor as you pursue your running and cycling goals. So essentially, what exactly does this chassis compose of? It composes of muscles, tendons, and ligaments, and the joints and the bones of the lower limb, namely the foot and ankle, the tibia, the fibula, which is basically your leg, and then your knee, and then your thigh bone, the femur, and then the hip and the pelvis. Not to forget the spine as well. Because you're running in an erect posture, there's a lot of forces that actually transmit through the spine. And this 1,300 tons of pressure can be distributed through this structure. And what we need to do is, before we actually do our runs, we need to make sure that we are actually optimizing this structure so that we reduce the risk of any injury happening. Basically, when we run or when we take any physical activities, there are 2 particular types of injuries that can happen. You could accidentally sprain your ankle. Now, that is something that may be unfortunate. It may be an acute type of injury. But what exactly a lot of runners actually complain of is the chronic type of injury that happens, especially if you're doing it on a very frequent, repetitive basis, because you may not realize that the stress is happening at a certain structure in your body, but eventually when it actually accumulates, then it causes problems, and that's when you feel the pain. So, before we run, stretching. Who needs to stretch? Why do we stretch? What do we stretch? When do you stretch? And how do you stretch? I think these are important questions to answer because stretching is sometimes overlooked by many people before they undertake a physical activity. But in my opinion, I think it's the most important thing that you can do to actually prevent yourself from getting injured. Yeah, so who needs to stretch? Everyone needs to stretch. Anyone who's actually intending to do a run, whether it's a short distance run or a long distance run, stretching is a very important component of your preparation to run. And why do you stretch? We stretch because if you do not stretch, your muscles are actually not functional. Your muscles are made up of fibers, and the fibers have what we call a working length. Now, you want the working length of the fibers to be an optimal length. And when you stretch, that's what you're doing. You're making the fibers get to an optimal length so that they're able to contract efficiently during your activity. Now, if you do not stretch and your muscles are not an optimal length, then it is not functional. And when it's not functional, whenever you're running, you're doing your activities, all the stresses are going to be borne by your bones and not your muscles. You're not redistributing the stresses properly, and that's how you get injuries. When do you stretch? So you stretch before your activity. That's very obvious. But I actually tell a lot of my patients, a lot of people that I see, you should actually also stretch after you exercise. Why? Because after you exercise, your muscles are all warmed up. And when you stretch after your exercise, you're actually improving the blood circulation to the muscles. You're actually allowing your muscles to recover properly with this proper blood circulation. And it also takes away all the toxins and all the waste products that have been accumulated during the exercise. And then it allows you to recover faster so that you can do your activity again in a more safer and you feel better doing your activity next. And how do you stretch? I suppose this is peculiar to every individual sport, the kind of muscles they use. But generally, I guess stretching, how do you stretch is something that is very personal to different people. But essentially, I think the most important thing is do stretch. Similarly, strengthening. Why is strengthening important? As I said, muscles tend to work together with the bony structures and the joints to redistribute the stress between them. So if you have stronger muscles, it also means that you take away the stress from the bones because your muscles are now strong enough to actually take more stress from the bones. So you prevent injuries from happening to the bones. And I actually liken this to actually like in a car, you have to lubricate your chassis. Stretching and strengthening is similar to that. You are actually basically preparing your body for the activity that you're doing. Some of the benefits of it, as I mentioned, muscle recruitment, improving the blood flow, and also priming the ligaments and tendons for the activity that you are doing. And I also say to my patients, don't waste your effort. If you are going out there for a run, taking your time to do it, make good use of something so simple like stretching before it so that you can actually help your performance and prevent your injuries. Okay, the next thing that we want to talk about is the weakest point of musculoskeletal structure. Now, you know muscles actually originate from bony structure and they also insert into the bony structure. Now, where it originates from and where it inserts into are considered the weakest point in a muscle. It's just like if I have a rope that's attached to a wall and I pull on that rope that's attached to a wall, where do you think the rope is going to come out from? It's going to come out from where it's attached to the wall because that's where the composition of the muscle changes to something else. And similarly, for muscles, the same thing. So many injuries actually occur at the insertion points of where the muscles are to the bones. And that's the reason also before engaging on activity, stretching helps to actually redistribute all these stresses accordingly within the whole length of the muscle and the tendon as well. And the other thing that's important to note is that some people have joints that may be a bit malaligned. And when you have a joint that's malaligned, what it also means is that the weight distribution is not taken by the bone completely. Sometimes it's taken by the muscles or the ligaments that are surrounding the joint. And you know the ligaments and muscles are not as stiff and strong as the bone. So the impact that they can take is usually lesser. And that's the reason why sometimes when you have bony malalignments, you can have pains in the joints because maybe the joint is not the right alignment. And the pain around the joint is usually in the ligaments and tendons that are surrounding the joint. And these are especially common, especially patients that have previous fractures, previous injuries to their joints. They've got other issues such as flat feet, both knees, or lower back issues as well. So the name of the game, as I've mentioned in the last few slides, is redistribution of forces. And running as an endurance sports, the nature of the injuries would be more of like the wear and tear type as compared to a sudden injury, as I was mentioning previously. So where can the 1,300 tons of pressure go? It needs to be redistributed. And I always like to say, recruit and redistribute. So recruit your muscles as much as you can and redistribute the stresses so that you actually prevent yourself from getting injuries. Now, if I make my chassis leaner, if I make my body leaner, will it help? Yes, it might. But I always let patients know that actually it's not about your weight. It's actually about your muscle amount as well, or your muscle mass as well. Because someone who's big but has got a higher muscle mass can actually withstand his weight because of the extra muscle mass he has. So the risk of injury is still less for the person. So I think that losing weight shouldn't be the goal, but I think getting strong should be the goal at the end of the day. So basically, we have learned so far about how you redistribute the forces and how you actually then prevent yourself from getting injured. And some of the things that we need to take note of is previous injuries that can affect the alignment of the joints or the bones, and also how we can actually stretch when you need to stretch before the activity and after the activity to actually help to redistribute these forces. So we'll go through some of the common conditions that can happen for runners and cyclists based on also the anatomical region. So like, for example, we'll talk about some of the common foot and ankle conditions that can happen, some of the common leg and knee conditions that can happen. And also we'll talk about some of the back and hip conditions that can happen. So essentially the entire lower limb structures, including the spine. So we'll start with the foot and ankle. So this is a very common condition that that can happen in many patients. And I would say that I see a lot of patients with this condition called plantar fasciitis. Some of you may know what it is, but essentially what plantar fasciitis is pain in the heel, at the bottom of the heel. And usually patients complain of this pain as the first step they take in the morning. And interestingly, it actually gets better as the day progresses. Now, why is it usually painful in the morning and better as the day progresses? The main culprit is tight calf muscles. So when you're sleeping at night, when all the muscles are inactive, the muscles tighten up. And the first step that you take in the morning when you wake up is always painful because the stresses is felt because your muscles are not woken up yet and they cannot redistribute the stresses. So all the stress comes to the heel and it's painful. So I always like to tell patients who have this condition to actually stretch in the morning and also at night before you sleep. And I tell them that it's like brushing your teeth. You brush your teeth in the morning, you brush your teeth at night, so you also need to stretch in the morning, you need to stretch at night. And the biomechanics of why this happens is because when you have a tight calf muscle, when you are walking, the movement of your ankle is not optimized. Because it's not optimized, all the forces tend to go towards the heel, and that causes pain. And it's also very common in patients who have flat feet and also in patients with high arch. And when we talk about flat feet and high arch, actually there are no absolutes. I like to explain to my patients that flat feet and high arch are just on opposite ends of a normal distribution curve or a spectrum. So there are some people who actually are in the middle, considered normal, but most people have actually a bit of flat feet or a bit of high arch. And that's the reason why even when some patients have some pains in their feet and they cannot understand why they have the pain in the feet, I usually, when I examine them, I actually have to tell them that, look, you actually have a bit of a low arch, but you may not realize it. So actually, the thing is that it's a spectrum and it's never like an absolute, someone with flat foot or someone with a high arch. And usually, why is it that patients with flat foot and high arch develop problems? Is because of mainly tight calf muscles. All right? And the principle to bear in mind is that the more higher your arch is, the more stiffer your foot is. And the more lower your arch is, the more flexible your foot is. And usually that actually has a correlationship with a tight calf muscle. So as I was mentioning, generally flat feet happens in patients or people with a bit more laxity in their ligaments and tendons. And it's also associated with hyperflexibility, bunions, a curved spine, scoliosis. And patients with flat foot usually also complain of pain on the inside of the foot. And that's sometimes called, in medical terms, the posterior tibial tendinitis or tendinitis. Now, what about people with high arch? Now, when you have high arch, it's usually less common than flat foot. But as I was mentioning previously, when you have a high arch, your feet is actually very stiff. Your bones are actually very stiff and they are not very flexible. And because of that reason, you can also develop pain like plantar fasciitis. You can also develop some stresses on the front of the foot, something we call forefoot pain. And because of these extra stresses, sometimes even with runners or people who hike a lot, you can actually get stress fractures which you may not realize. All right. And the other thing that the patients with high arch get is usually easy ankle sprains as well. So as I was mentioning, the pictures on the far left, the left-hand side, you can see that there's basically pain in the forefoot on the undersurface of the feet. And this over time can usually cause the nerves to become inflamed on the underside of the feet. And this particular condition is called Morton's neuroma, which means that the nerve is inflamed at the bottom of the feet. And many a times patients who have this condition usually have a bit of high arch problem and they have very tight calf muscles as well. And similarly, because of the increased stresses on the front of the foot, they can sometimes even develop something called a stress fracture on the foot. And this stress fracture is something that patients might not realize because they don't have an injury per se, but after maybe walking for some time, after a few days, they complain of pain in the foot, and the pain is quite severe, associated with some swelling. And then when you do an X-ray for them, sometimes you can't even see a fracture on the X-ray, but an MRI would be able to show that there's a fracture there. And easy ankle sprains. When you have an ankle sprain, usually some things can happen to the ligaments the ligaments can be either stretched or it can be torn. But what we are always afraid of is when ankle sprain happens with a cartilage injury, as you can see on this MRI scan on the bottom right. You can see that there's this white patch and shadow on the bone right over here, and this is a sign of cartilage injury. All right, and this is usually something that is suggests that the ankle sprain was quite severe. And when there's cartilage injury, it usually is something that needs to be addressed, because when cartilage is injured, it is usually the start of something like arthritis coming on in the future. And some of the procedures that we do to actually address cartilage injuries, as you can see, we try to get the bone marrow to come out from the cells to actually help in the healing, as you can see from this picture. All right. Now we talk about now Achilles tendon problems. So Achilles tendon is the other condition that affect runners quite commonly, and the Achilles tendon is actually composed of structures that come from the calf muscles. So the calf muscles actually originate from above the knee, at the back of the leg, and they actually go on to insert on the heel bone, crossing three joints actually: the knee joint, the ankle joint, and another joint called the subtalar joint as well, which is just below the ankle. And Achilles tendon can have what we call insertional issues. That is actually issues or conditions that affect it where it's inserting into the bone. And it also can have non-insertional issues. And these are issues that happen with Achilles tendon itself that is not really inserted on the bone, but it's above the insertion. And what we have to understand on Achilles tendon problems is that Achilles tendon problems actually get more common as we age. Because as we age, the Achilles tendon loses collagen. And because we lose collagen, it loses the elasticity. So I like to explain to the patient, this is the difference between a cooked noodle and uncooked noodle. When you have a cooked noodle, it's very stretchable because there is actually a lot of water content in it. But an uncooked noodle is very dry and it can easily crack and be injured. So that's the difference, and that's the similarity of our Achilles tendon as well when we grow older, because we lose this elasticity as we age and it becomes more like an uncooked noodle, and the risk of injury is higher, especially explosive exercises, such as sometimes badminton, sometimes tennis, or even jumping sports. And some of the peculiar anatomical reasons why Achilles tendon sometimes causes issues is because also of the blood supply of the Achilles tendon. So the Achilles tendon has got a very tenuous blood supply at certain regions of the body or the Achilles tendon. And that area where the blood supply is not so good has a tendency to develop problems, and it becomes a bit more degenerative, and the risk of injury at that area is usually a bit higher. Right? Now, how do we actually treat Achilles tendon problems? So most of the time, Achilles tendon problems, if they have not caused much injury already, you can actually treat it with some physiotherapy, such as eccentric stretching exercises, and also something called shockwave therapy. However, if these measures don't seem to work for patients, sometimes we need to actually do some minimally invasive surgery. Okay. So, for example, in this particular picture, we are talking about something called endoscopic calcaneal plasty. So, because Achilles tendon problems usually can happen at the insertional areas of the Achilles tendon. So, some patients have what we call a bony spur at the insertion of the Achilles tendon. And this spur is usually the cause of a lot of pain that they feel at the insertion. So, the spur cannot be removed by physiotherapy or any other treatment. So sometimes we have no choice but to actually do surgery to remove the spur. As you can see, this is an example of the spur that you have. And when we do this kind of surgery, we can actually remove the spur and relieve the pain from the patient. What about shin splints? Shin splints are also very common among runners. And usually it's due to unaccustomed sudden activity, especially if you're not been exercising for some time and you have come back to the sport and you do something a bit more intense, you can actually get shin splints. Okay, these are usually better with stretching and improving the leg regularity of exercise. And what will help in the initial period is usually some rest, icing the area that's painful, and anti-inflammation medications. But one thing to note is that if it doesn't really get better with all these therapies, sometimes it may be best to seek medical attention, because shin splints can occur very similar to also a stress fracture of the tibia. So we have to take note that if let's say the pain doesn't get better after about 2 weeks or so, and it's still swollen and tender, it's better to get an X-ray done or see a specialist to actually get this assessed properly. Okay. And the other thing that we talked about is delayed onset muscle soreness. So what exactly is delayed onset muscle soreness? So this is actually a syndrome that I think a lot of us may have felt before, but happens actually after exercise, and usually it happens after 24 to 72 hours after the exercise. Now, it usually also happens because maybe there's some lack of stretching also, and maybe the exercise is started without much tapering, or much ramping up properly. So you actually do something quite strenuous from the get-go, and that actually can cause the muscles to undergo this inflammation, and the inflammation is the one that causes the soreness that the patient feels. Okay, so you've got different kinds of muscle contraction. So if you're doing a biceps curl, for example, we call this concentric muscle contraction because the muscle is shortening as you're putting your load through the muscle. And then you've got something called isometric exercises. Isometric exercises is something like planks. The muscles are not actually contracting, but they are actually being tensed up at the same length. So that's why we call them isometric, because the length is the same with the muscle, right? And then there's something called eccentric. Eccentric is whereby you're actually contracting the muscle against the lengthening muscle. So what that would mean is, like, sometimes when you're doing like a knee extension exercise, for example, and you're extending your knee against some weights. Now, when you're actually extending the knee is fine, but when you're actually relaxing and you're coming down very slowly, you're actually contracting the muscle, but the muscle is being lengthened at the same time. And this is actually the reason why sometimes this can cause delayed onset muscle soreness, because you're actually contracting the muscle while the muscle is in the lengthening phase. So I hope you guys can appreciate that. And essentially the treatment for it is essentially ice, some analgesia, ice baths during the recovery days. That would be helpful to actually prevent this delayed onset muscle soreness. And calf muscle tears. So this is actually quite common in runners who usually have a sudden and quick change in pace during the run. So things like interval training, when you're actually jogging in a very recovery pace and then suddenly you do an interval training for about 1 minute, 2 minutes, that can cause the muscle to actually suddenly tear. And basically the treatment is conservative. Usually surgery is not needed because the muscle has a good chance of healing, all right? But usually what can prevent these injuries is adequate warm-up and stretching to prevent these from happening. And in patients who actually have these injuries, sometimes they may need to wear a walking boot for about 2 weeks just because for pain relief and also to allow the muscle to heal. And this is another common condition that happens in runners and also in jumpers. It's called jumper's knee, and the medical term for it is patellar tendinitis. So the pain actually occurs at the region of the patellar tendon. So the patellar tendon is actually a tendon structure that actually goes from the kneecap itself to the leg and the front. So why does this happen? Usually it's because the muscle, the quadriceps muscles may be a bit weak. And because it's a bit weak, all the stresses that happens when you're running or when you're jumping occurs at the insertion of the tendon to the bone. And because it's so repetitive, this can cause pain. And usually the treatment is usually rest, ice, anti-inflammatory drugs, and physiotherapy. Some people can use something called this Chopet knee brace. So this helps to actually reduce the tension on the patellar tendon itself, and you can actually continue your activity if it's not so severe. And there's another condition that also can happen in runners. It's sometimes called runner's knee, and most of this is usually patients present with what we call anterior knee pain. So this is pain in the front of the knee, and the reason why this happens is because there's usually some form of cartilage softening at the back of the kneecap. As you can see on these MRI scan pictures, if you look at the back of the knee here, the kneecap, you can see that there's some white areas here, and these white areas are what we call signal change. So the cartilage is actually undergoing some inflammation at this area, and this can cause pain. So most of the time, this can be treated with just physiotherapy with a focus on quadriceps strengthening exercises, because that will reduce the stress that the kneecap feels. Because as I said before, your muscles and your bones are sharing the stress. So if you want to reduce the stress felt by your bone, you need to strengthen the muscle so the muscle takes over the stress. Similarly, this is another condition called quadriceps tendinitis, and you can see that it's actually there's a lot of signal change on the quadriceps tendon, which is basically the tendon that is above the kneecap, all right, where the quadriceps muscles attach to the kneecap, and there's some white signal change here, which shows that there's some inflammation of the tendon attached to the kneecap. And the causes are very similar to patellar tendinitis, usually because there's some muscle weakness, and it's usually worse during activity as well. And the treatment is usually rest, some icing of the area, physical therapy, and focusing on eccentric exercises and strengthening and stretching the antagonistic muscles, which is basically your hamstring muscles, so that the stress is felt less by the quadriceps muscles. Okay. Another common condition in runners and cyclists is something called iliotibial band syndrome. This is basically pain at the side of the knee, where exactly the patient is pointing at the side of the knee here. Now, if you look at the anatomical picture on the bottom, there's this structure, this whitish structure here. This is called the iliotibial band. So this band actually comes all the way from the hip joint at the side, and it inserts into your knee, at the side of your knee. So what happens is that because of the repetitive flexion of the knees, this tight structure usually undergoes friction at this area against your bone. And that's the reason why it gets inflamed, because of the repetitive flexion and the activities that happen. And a tight ITB or iliotibial band is usually the cause of this problem. So stretching the ITB is usually the treatment for patients with this pain. All right. And sometimes they may need to reduce the training intensity as well, so that there's time for it to recover. Yeah. And some of the other common things that can happen in runners is what we call joint issues within the knee itself. So within the knee itself, there are many structures. There's the ACL, there's the anterior cruciate ligament, there's the PCL, which many people will not know, but the ACL is probably something that a lot of people know because it's very commonly injured in footballers, and we know footballers who have ACL injuries. But the PCL can be injured. PCL stands for posterior cruciate ligament. It's just behind the ACL as well. But the PCL injury is actually not as severe than an ACL injury. All right. And of course, the other structures in your knee is your meniscus. Like your meniscus is actually these two C-shaped structures that you can see over here within your knee. So the way the meniscus works is that it actually helps to be a shock absorber for the knee. So usually when you have a meniscus tear, what happens is that this shock absorption function is actually lost. And the meniscus tear itself means that there's some structure that is inside the knee and is like flapping about within the knee. So a lot of patients with meniscus tears sometimes have these abnormal clicks or painful clicks in the knee when they try to bend the knee in certain angles, and that can cause pain. All right. And the other condition that can happen is arthritis or early arthritis, because our knee is also filled with articular cartilage, and this is the cartilage that actually helps to lubricate your knee joint when you're doing your movements. But especially in some patients who have had previous injuries, previous fractures, malalignment of the knees, sometimes this cartilage can undergo wear and tear. And when it actually undergoes wear and tear, the pain is usually felt, especially in impact activities such as running. Okay, the other condition that can happen is something called piriformis syndrome. So what is piriformis syndrome? Piriformis syndrome is something that happens in your hip joint, at the back of your hip. And there's a nerve that's coming out the back of your hip called the sciatic nerve. It's coming down this way, all right? And you've got a lot of muscles that are actually straddling the nerve. So especially when the muscles are under contraction because of a lot of activity that you've been doing, a lot of running, your muscles are constantly under spasm. Because of that reason, sometimes patients feel this shooting pain that goes down from their hip, from the back of the hip, right down to their knees. And that is usually due to this sciatic nerve syndrome or the piriformis syndrome, because of this compression of the sciatic nerve. And what we usually would advise patients is stretching. Stretching to help to stretch the muscle so that it's relaxed and it's not under tension, causing the pain. And of course, resting, putting some ice, taking some anti-inflammatory medications to actually reduce the spasm will help as well. Okay. Now, the other common hip injuries that can happen is something called labral injuries to the hip. So what is this labrum? The labrum is actually a covering of the hip. It's something like the cartilage, but it's actually not the cartilage. It's more like a covering of the hip. And sometimes when we do long distance running or cycling, especially if the bike fit is not very good or the running technique needs to be improved, this labrum can be injured. And when it's injured, usually patients feel a lot of pain in certain activities, like certain flexion of the hip can cause this pain to come constantly. Now, the treatment depends on how bad the tear is, how bad the labral injury is. Sometimes if the labral injury is very bad, surgery may be required because we will need to repair something that's torn and is causing this pain in the joint. However, if it's not so severe, usually some kind of core and flexor strengthening exercises will actually help. Okay, now we go on to some spine disorders, because spine disorders can also commonly affect runners because, you know, we are all running upright and there's a lot of forces that go through the spine. So generally speaking, we all know about the very common slip disc problem, which is basically what we call a disc bulge. But slip disc is actually only one of many problems that can happen in the spine. Sometimes there's something called annular tears. So annular tears are where your disc itself can develop tears at the back. And although it doesn't cause pain going down your legs, it can cause severe back pain. And this back pain is usually very severe and usually takes a long time to heal. But usually when you do an MRI scan, you don't see any nerve problems, but it's just that the tear, there's a tear of the disc area, all right? And of course, in patients who have had previous injuries to disc or previous slip disc, what we usually would advise is do a lot of core strengthening exercises because, as I mentioned, your spine is a bony structure and your core is actually supporting your spine. So if you want your spine to be healthy and to take less stress, you need to do the strengthening of the muscles around the spine so that the muscles will take over the stress of the spine. Okay, so how do we prevent injuries? So, sorry, let me go back. So we can actually learn from professional athletes. And I mean, I believe that it's great that, you know, we are doing all these fitness activities because it's at the end of the day, we want to live a healthy lifestyle and prevent other chronic problems and diseases. But when we do our activities, especially when we do something regular, we need to know some principles of training. And what I've learned over the years as well, being an athlete, is that sometimes less maybe more. And, you know, we tend to sometimes have this feeling that no pain, no gain. But I think it's time to move away from that kind of thinking because sometimes it's not really constructive or it can actually lead to injuries. And most of us are not athletes full-time. So we usually do this when we have finished our work or even before we start our work. So I know that time is usually a factor, but it doesn't mean that since you have so little time, you need to do the most you can do within this time because that would actually be the one that leads to injury. And it's good to actually have some goals like races or some events and basically then periodize your training so that you can peak for those kind of events. And that actually is a very safe way to train. And there's a very famous Dr. Steven Seiler who basically works with a lot of athletes. And he has noticed that, you know, the way the athletes train, and we're talking about like Olympic athletes even, is they do a 80-20 rule of training. So only 20% of the athletes training is actually what we call high intensity training, but 80% of the training is actually very low intensity training. So it's more important actually to be more consistent than to pack intensity within a short period of time, which can lead to injury. So something about diet as well and timing of exercise. So depending on the time of day, I just like to say maybe avoid late dinners after 8 p.m. So many of us, maybe we come back late from work and if we need to exercise after work, it's always better to exercise after dinner, giving yourself maybe a 1.5 hour delay after your meal before you exercise. And I also tell my patients that, you know, if you want to diet, always have a very good breakfast and then maybe not so heavy lunch and have something light for dinner. That'll always be good because it actually follows how insulin is produced in your body. So insulin is usually more in the morning and it's less in the night. So if you have a very heavy dinner, then you're actually telling your body to produce insulin at a time where your body is not trained to do. So that's the reason why, you know, sometimes diabetes can happen because you're actually stressing your insulin production in the body. And it's always more beneficial to exercise in the morning because it coincides with your growth hormone peaks. And So when your growth hormone is high, and when you exercise in the morning, your adaptations in your body are longer lasting. And I would like to say also schedule recovery days so that you can recover from your activity, and then you can go on to do another activity the next day. And I try to avoid caffeine in the evening after 6. Coffee is good in the morning, pre or post workout. And some people like to do something called a faster workout. So a faster workout is a workout where you don't have your breakfast and you go and do a run, or you do a cycle. But the only thing about this to note is that try to keep the intensity low and the duration low as well, because a faster workout is trained to actually metabolize fat in your body. But if you try to do something that's more intense, then you start to burn carbohydrates, start to burn proteins, and that's not good for your general fitness. Okay, I think I've come to the end of my talk.
Okay. Anand, thanks for that.
Yes. Yes.
I think
Yeah.
some of our runners will probably have some questions for you. So
Sure.
I know you had mentioned that there was a short 10-minute video.
No, it's okay. You can save that video in your for the runners who want to see it later. It's fine. It's not so important. Yeah.
Maybe we can get that link off you, and then we can share that amongst the runners. But
sure.
We will now take questions from the runners. We've got about slightly over 30 people on board.
Okay.
And I'm sure they have questions.
Sure.
I was speaking with Naz earlier. Naz is, as I mentioned, is moderating the session with me.
Okay.
And he had said he had some questions for you.
Sure.
Maybe Naz?
Sure. Thanks, Dr. Anand. I thought it was very, very insightful.
Okay.
I think oftentimes we don't tend to appreciate how complex the body is, with so many bones and muscles and the interlinkages, right? Now, I found it fascinating when you spoke about the feet and the ankle injury, right? So could you give us some insight into, the importance of shoes? How do individuals pick their shoes? Because if you think about the group here, right, we've got people of varying natures and skills. Right? We've got people who are beginners who are walking. There are people who do the basic jogging. And then we've got our pros who kind of run like crazy, right? So what is the importance of shoes, and how do you go about selecting shoes that support the feet and the ankle, which are incredibly important based on what you're telling us?
Yeah. So that's a very good question. So essentially, okay, thanks, Nas. So when I advise patients about shoes, there are 3 components to a good shoe. So the first component I would say is a good heel counter. So that will mean that it has good support at the heel, at the back of the heel, right? The second component is a wide toe box. So when you have the toe box is where your toes are actually within the shoe, and that needs to be wide enough. And some people have very wide forefoot, and you need to select shoes that are accommodating that wide forefoot. So there may be brands that may be more suitable for that, and there may be brands which may not be suitable for that. So like for a cyclist like me, I mean, just talking about cycling shoes as well, which can be relevant, for example. So like there are many brands for shoes for cycling, but I like Shimano's because I've got a wide toe box. So Shimano produces shoes with wide toe box. So different shoe brands may have different peculiarities, and I think the only way you're going to find out is you actually go to the shop and try it out. Now the third component is an insole. Now the insole is actually what actually supports the arch in the inside of the foot, and that is extremely important because when you're doing running, for example, every step you take or every running stride that you take, it's a process. So your heel strikes the ground, then the foot becomes flat, and then you're using your toes and your forefoot to push yourself out. Now, if you do not have a proper support of your middle or the inside of the foot, what you're going to realize that you're going to stretch the tendons on the inside of the foot to an extent that it may lead to injury. So that is the reason why having an adequate insole is always important for a shoe. Now, most sports shoes are quite well designed, or most running shoes are actually very well designed. So, for example, you've got if you talk about the front of the running shoe, that you see a rocker, so it actually lifts up slightly in the front. Now, that's important because it's actually trying to help you in your foot off phase of the running. So that's the reason why that kind of modification is important for running shoes. But you don't have it for like tennis or other shoes because that's not so important for them, you know, in that kind of sport. You don't have it for cycling shoes as well because that's not necessary in cycling shoes. But for running shoes, that's important. And for some patients who actually may have other medical problems, sometimes we actually try to modify something called a double rocker. So there's actually a rocker even at the back of the foot because they may have very tight calf muscles, for example. And if you have a rocker at the back of the foot, then that helps your heel strike position as well and it helps to propel you from that phase to the foot flat phase as well. So it's actually not so simple to select shoes, but I think the important thing is to try it out, I would say.
Okay.
Sure. Thank you, Doctor. Thank you, Doctor.
Thanks, Anand. I think I saw Maithili, she had her hand raised. So did you have a question, Maithili?
So basically, I wanted to ask, what then would your thoughts be on barefoot running? And, you know, there's a whole movement towards people who are choosing not to use any cushioning possibly because they have modified their running strides to prevent heel strike and basically land on their forefoot. And this seems to work for quite a few runners, including me. So every time I wear something with a lot more support, I tend to get injured. And that, I suppose, I think that's how I've always been able to run. I've never landed with my heel strike. So what are your thoughts on this? And is there a possibility that I'm actually asking for more problems in the future, like needing a hip replacement perhaps? What are your thoughts on this?
Okay, so I mean, I don't really know about barefoot running per se. I don't really know much about it, but what I would say that if you talk about biomechanics of running, for example, I don't think that forefoot running is advisable, honestly, as in, because at the end of the day, when you're doing forefoot running, you're actually stressing the stiffest part of your foot. And all the stresses are going right down there without any transfer from the back of the foot or the heel. So essentially, when you run, what exactly happens is that when you're heel striking and then you're coming your foot flat and then you're pushing off, your foot is actually doing a lot of things in the process. It's changing from a flexible to a stiff structure, and it's becoming a flexible structure in alternate time phases. So basically, when you're pushing off yourself, when you're running, when you're pushing off, your foot can only push off because it's a stiff structure. That's how you propel yourself. It becomes a stiff structure when you're pushing off. When you're heel striking and you're going to become foot flat, your foot is preparing to become a flexible structure. That's the reason why when you're usually more comfortable in uneven ground when your foot is flat. You're not comfortable in uneven ground when your foot is on tiptoes. That doesn't make sense, right? You feel unbalanced. But when your foot is flat, you'll feel more comfortable because it's a flexible structure at the time. So if you're running forefoot, ideally you're basically telling me that you're running on a very stiff structure all the time. So I mean, it's great that maybe you don't have problems. Perhaps it's well-trained, or you're well-trained, or you have adapted your running style to not give you any issues. But I mean, generally speaking, for most of my patients, if I'm actually advising them on running styles, I would say that it's better to have a conventional running style with heel strike, foot flat, and toe off, because that's the best way of redistributing the stresses. And that's what my talk was about, actually redistributing the stresses to prevent injuries. Yeah.
Okay, brilliant. Anand, there was a question from one of our runners, Madan. His question, I'll just read it out. Question was, any advice on disc bulge at L4, L5? Is it advisable for long runs? He says that it's usually painful, and he's rated his pain as 5 out of 10 post-run for a few hours, and then it gets better after that. So his question is, obviously, I think he's suffering from this condition, and he wants to know whether long runs are advisable given the condition.
Okay, so I think that with a L4, L5 disc bulge, okay, so a disc bulge without, it seems to me that he's complaining of just pain in the back with no pain going down his legs which is something that's probably, I would say, maybe a mild disc bulge, not pressing on the nerves. So generally speaking, I would say that at this moment in time, if he's having pain, he probably needs to do some physiotherapy to strengthen his muscles, get some, back strengthening, core strengthening done before he actually engages in long activities. And what he could do is he probably could do something short duration first in the meantime, something that doesn't cause him so much of discomfort. And as he strengthens his muscles or his core strength, then he could probably do more longer runs. But I don't think it's a contraindication to doing long runs, unless his condition is happening with some kind of a nerve injury. I at the moment, from what he has explained, is just basically back pain. So usually my advice to him is get some physiotherapy done straight away. Try to reduce your duration for now. Try to rehabilitate yourself, get your core strength and your back strength going, and then as time goes on, you can actually increase the duration of your runs and your distance.
Okay, thank you, Anand. There is another question from one of our runners, Vinod. He's just raised his hand to ask a question. Vinod, feel free to unmute yourself and go ahead.
Hi, Sean. Thanks, Ramesh. Hello, doctor.
Hi.
Okay, doctor, I just have a question or an advice that I would need. So kind of a perennial ankle pain on my left leg, which is which doc says, and okay, another doc says it's because of the gout. And it's there, it's not going away anyways, but I learned to tolerate the pain. So that's how I survive, do minimal runs. Sometimes 10K is the max. Very rarely 15K is something that I can stretch out to. The question to you that I would like to know is there a way that this can be, this perennial pain can be gone away, or something that I can do, try out?
Okay, that's a good question, Okay, so a few things I need to ask. Okay, so you have said you've got, I suppose what you're saying is a peroneal tendon pain. Is that right? At your ankle?
Yes, it's a perennial pain.
So the peroneal tendons are actually, interestingly, they are what we call the secondary stabilizers of your ankle joint. So there's actually another stabilizer called the primary stabilizer, which is basically your ankle ligaments itself. I'm not sure whether an MRI scan was done or how the doctor diagnosed the peroneal tendon pain, but I'll be interested to know what the stability of your ankle is, because you see, the reason why your peroneal tendons may be painful or it's being stressed or injured could be because they are the secondary stabilizers that are being used right now, because your primary stabilizers may not be working so well. So it's important to know what the ankle stability is like. Is your ankle ligaments actually stable, or are they dysfunctional or just not working properly? Because gout, as you know, actually affects the joint more than the ligaments or the tendons. So it is possible that, and I've seen cases myself personally, that where gout actually affects the stabilizing ligaments of the ankle joint, and to the extent that it's not really working so well. And because of the fact that those stabilizing ankle ligaments are not working so well, patients are forced to compensate by using the secondary stabilizers. And that's what you may be using with the peroneal tendons, causing the pain that you're feeling and the discomfort, you see. So, I think what can be done is, okay, so if you want to actually do something to try to see whether your pain gets better, is you need to try and do some what we call peroneal strengthening exercises. So you can try these strengthening exercises to actually see if that helps your peroneal tendon pain. But I would also say that it will be good for you to actually assess the ankle stability, because that is something that I'm concerned when you say that you've got gout as well. Yeah.
Okay, doctor. MRI was not done. Maybe that could be the first step that that I can take for.
Sure.
Right. Thanks, doctor.
Thanks.
Okay, we still have another 10 minutes or so. So happy to take questions, guys. Anyone else has any further questions for Dr. Anand? Please feel free to just unmute yourself and ask your question.
Yeah, hi, doctor. This is Ramesh Sharma.
Hey, hi, Ramesh. Hi.
Hi, another Ramesh.
Yes,
So, quick question. So,
Yes.
you spoke about the tendons and how tight it becomes with age. So, are there any the popular supplements are like collagen or glucosamine in the market? Would that be helpful? I mean, given that we do a lot of exercises like this.
Yeah, okay, that's a good question. So, okay, so let me address glucosamine as a product, because it's very popular among a lot of people, a lot of patients, and actually glucosamine is a component of your cartilage, and the reason why it was popularized a lot is because there was this commercial kind of outreach that if you take glucosamine, you can prevent yourself from getting arthritis, or you can regrow your cartilage. But interestingly, the studies that have come out of the US over the past like 5-10 years, right, have consistently said that glucosamine actually does not have any effect on cartilage. So the only things that work for cartilage preservation and cartilage or arthritis that is treated conservatively without any need for an operation, there are only two things. One is the taking of anti-inflammatory drugs, and the second thing is physiotherapy with a focus on quadriceps strengthening exercises. So these are the two things that the papers and all the research has seemed to point to. So in terms of glucosamine, I tend not to prescribe patients glucosamine unless patients tell me that they've taken it before and they have really felt that it helps them. And I like to say that this is what I would say a placebo effect, where you actually take something, and although the science doesn't show that it works, but you are psychologically good for it, and there's no harm in it. Because I mean, who is to say that you are not feeling the pain? Who am I to say that this doesn't work for you? If it works for you, please, I'll let you take it. But one caution is that glucosamine contains high amounts of salt. So if you have someone with hypertension, for example, I would be a bit more cautious on prescribing glucosamine for them. Now, talking about collagen supplements. So collagen supplements don't really work in that particular way, whereby you're actually reduce your collagen collagen content in your body or your tendons reduce as you age. But it doesn't really work in that way when you take collagen supplements, that it replaces that collagen, because actually collagen is actually essentially a protein. And when you are taking this collagen, it actually, the truth is that it actually gets digested in your body into amino acids, and it will not recreate the collagen molecule again in your body. So it doesn't make sense when they say you're taking this collagen supplement, but this collagen supplement is going to replace the collagen in your body. It doesn't make sense, because it's digested first into amino acids and then it goes into your body, and it doesn't really replace the collagen in your body.
Great, thanks for the insight. So what you're basically saying is, strengthening and anti-inflammatory, products that will help with the pain.
With the pain from let's say there's so the arthritis has many different forms. So there's severe arthritis, there's moderate arthritis, there's also what we call cartilage defects. So sometimes if you have a cartilage defect, I'm not sure whether there's an MRI scan or something that's been done, but if it's just an area where the cartilage is not so good, where it's a bit more damaged, there are still some things that can be done to actually help patients with this problem. Like there are some minimally invasive surgical options where we can replace the cartilage of the area that is worn out. But of course, when we talk about things like there's a large area of cartilage injury or there's arthritis per se, then of course in those patients, we will need to probably do some physiotherapy, some quadriceps strengthening exercises as a temporizing measure before needing a knee replacement, for example. So it really depends on the severity of the problem, rather than just a one-size-fits-all kind of approach. Yeah.
Thank you very much, doctor. Thanks for the insights.
No problem.
Okay, Doc, we have, I think, two further questions. One from one of our runners, Shanti. She's shared that she's been diagnosed with a multiple slip disc in the neck. She's currently doing brisk walking. She hopes to be able to run gradually. She wants to know whether this is something she should avoid. Is there something that she should be looking out for, given her hope is to be able to run soon? She's currently seeing a physio, I understand, and the idea is to strengthen her upper spine and neck.
So thanks, Ramesh. Yeah. Hi Shanti, hello. Actually I've got good news for you, in a sense that I think running shouldn't be a problem once you have finished your physio and your strength has come back. It's usually more common to have neck problems, especially because of posture. And I think that's something to take note of, because I've seen a lot of patients with neck problems over the past 1 year because of the work from home. They've been adopting quite poor postures, and because of that, sometimes you don't realize the amount of stress that your neck muscles and your spine actually goes through because of that. Of course, there can be injuries as well that you can get, like maybe an accident or injury from a fall, and you can get neck problems or neck pain because of the slip disc. But essentially, when you have a slip disc of the neck, I think physiotherapy is usually quite successful, especially if you do not have any nerve conditions with the slip disc. So it'll be good for you to try the physiotherapy, get your muscle strength of your neck back, attention to posture, especially when you're sitting down in front of the computer, making sure things are level at your eye level. Yeah, and then you should be able to get better running without any issues. Yeah.
Okay, thanks, Anand. We've got another question from Muru sir. His question is about varicose veins.
Okay.
So he says he's got this condition on both legs. He had surgery to treat this some years back, but it looks like it's resurfaced. This condition has come back. He's been a long distance runner for some time now. His concern is he wants to know whether or not this condition is going to impact the running, or whether the condition will worsen as a result of all the running he's doing.
Okay, so actually no, I think you can run, and I think running is a very good treatment for varicose veins, because so why do you get varicose veins? Essentially is because there's a very high vein pressure in your legs, and because of that reason, the circulation is a little bit it's a bit impaired. So a lot of pressure is transmitted, and you develop these varicose veins because of this pressure. When you are running, interestingly, what happens is that you're actually activating the muscles of your legs, and the muscles are actually a natural pump to pump that blood back to the body. So you're actually preventing your varicose veins from getting worse by doing running or doing any lower limb activity in a sense. But what is important to note is that if you have varicose veins, I would say that it's good for you to get, I'm not sure whether you've had a scan recently, like what we call an ultrasound scan or DVT scan, because with this increased pressure in the system, sometimes, especially if you're more sedentary, you can sometimes develop something called a deep vein thrombosis, or DVT, or what we usually will know as the economy class syndrome, for example. So there's always a risk that patients with varicose veins can develop deep vein thrombosis. I mean, less likely if, of course, you're leading an active lifestyle and you're always on your feet, but it's still worth checking with a scan to make sure that you don't have this problem, or DVT scan, because that sometimes can be a cause of the varicose veins as well.
Okay, thanks for that, Anand. I'm just mindful of the time, and I just want to make sure that we stick with the time that we've allocated. So I think we can take two final questions before we wrap up. And so I'm just inviting anyone on the chat to feel free to unmute yourself and ask a question that you had in mind or have in mind.
Hello, Doc. It's me, Alan.
Hi. Hi, hello. Hi.
First things first, I want to thank you for the time and all the information you have provided. It's very, very helpful.
Thank you.
I've been an avid smoker for 30 years and I gave up like 6-7 months ago.
Okay.
And I've been trying to get fit and healthy and run and do whatever I could. What are the signs that I should be mindful of that when I'm running, if I'm going through some sort of uncomfortable situation, when do I just stop and say that this is enough, I got to get back home or seek help?
Okay, so generally, okay, so I think it's first, I think it's great that you have adopted this healthy lifestyle, and I would encourage you to do so. I would say that in terms of physical activity, what I would advise you is perhaps getting some kind of monitoring device, like a heart rate monitor, for example. Because I mean, I think a heart rate monitor will actually be a very good tool to actually calibrate your effort. And what I generally would advise is perhaps your efforts should be within maybe 60% of your maximum heart rate. And I mean, you can actually make a calculation of maximum heart rate based on your age and take 220 minus your age. That would be your maximum heart rate. And trying to keep to that particular heart rate zone is something that you should aim to do. And I think perhaps just doing 45 minutes to an hour, I mean, let's say you're doing brisk walking, 45 minutes to an hour is fine. But if you're running, you could actually even do half an hour within that particular time zone on a regular basis. And I think that will be a very good exercise for you. And as time goes on, and as you get fitter, and as let's say you monitor your resting heart rate every morning, and that's what I do. I think monitoring a resting heart rate every morning is a very good way to know how much you've progressed. And if you can keep a record of it, and you know that you're progressing in the right direction, it's time for you to maybe you can step it up a notch. Maybe you can go up to 65% of the maximum heart rate and just maybe increase the duration. So I tend to prefer increasing the duration rather than intensity, because I think increasing the duration is a bit more it's a bit less stressful for the system than increasing the intensity for you at this stage. But as time goes on and you get fitter and you maybe can go up to maybe 45 minutes of running, then perhaps you can increase the intensity a bit. But remember, when you increase the intensity, try to reduce the duration. So you try not to do both together at the same time, because that will be more stressful for the system. But I think the take-home message is that for someone who's keen to actually get back to this activity and you want to be safe, I think a monitoring device is always the way to go, because that will be the safest way to actually know how you're progressing.
Thank you, Doc.
Okay, Anand, there's I think this you probably get this question quite a bit. This question relates to supplements. I think it's a follow-on from what Ramesh Jarma had asked earlier about glucosamine and collagen and all. If we were to ask you, are there supplements that you, as a treating physician or an ortho, are there supplements that you would recommend for people who are running regularly or into a fitness lifestyle?
Yeah, so definitely. So I would recommend. Okay, so the supplement that I would recommend usually is vitamin B and also vitamin D with calcium. So especially so vitamin D and calcium, because it is a fact of life that most of us just don't get enough sunlight in this day and age. I mean, it's not like we were forefathers working the fields and we got adequate sunlight at that time. But in this modern day and age, we are just not getting enough sunlight. And especially so for women who already have a higher risk of maybe frail bones, especially after menopause or maybe in the perimenopausal age, vitamin D and calcium supplements are even more important. So I would say that's an important, that's a good supplement to take if you take a supplement. And vitamin B is also a good supplement to take, because vitamin B generally, it helps your nerve health at the end of the day. And when you're doing something like running, or you're doing something that is important with psychomotor skills and your nerve and neuromuscular junction triggering and communication, I think vitamin B is a good supplement to take.
Okay, thanks, Anand. I think we got one final question, and then I think I will ask the moderators whether they have any final wrap-up questions, and then we can close this. But we have a question from one of our runners, Uma. Uma, please feel free to unmute. Yeah.
Yeah. Hi, Dr. Anand.
Hi, hello.
Hello. Hi. Okay. My nature of work, I wear high heels, and only on Saturdays I used to run, not say very long distance or high intensity, just a slow jog. But recently, for the past 1 month, I have really, I have very painful sole. I don't know whether is it because like Mondays to Fridays I'm on high heels and then I'm switching to shoes on the weekends. What would you advise for people like me who's like wearing high heels and stuff?
Okay, so just a bit more about your pain. Is it something that you've noticed suddenly, or I mean only when you started running, or how did it start?
Okay. It wasn't there last time, but I don't know whether it's with the age it's catching up or what. But for the past 2 months, I've noticed this. So when I'm also not sure, because work from home was allowing me to, not wear high heels and stuff. Now I'm back to office. So that's the reason why I suspect, could it be because I'm wearing high heels most of the time and then I'm switching back to track shoes and stuff?
Okay. So generally speaking, I get this question quite a fair bit about high heels and whether they are good or not. So I would have to say that actually, if you wear high heels for prolonged duration of time, it may not be so good for your foot and ankle biomechanics, because what high heels does is that, as I was mentioning previously to Maithili, who asked me the question on the biomechanics of running or walking, for example. So, when you're on high heels, basically your heel is on the higher level than your foot. So a lot of pressure is taken on the front of the foot. And it's essentially a very stiff structure. Your foot becomes a very stiff structure when you are putting pressure on the front of the foot. And because it's becoming a very stiff structure, all the stresses are always going to be transmitted to the entire foot. So there's no flexibility of it, because when there's a flexible part of your foot, the stresses are dissipated equally. But when it's become a stiff construct, all the stresses are all going to be transmitted directly onto your foot. So because of that reason, it is possible that also you may develop some tight calf muscles. And because of that, when you're switching to running, we have flat shoes, I'm not sure whether you're stretching adequately, but you could develop pain on the heel. Now, the only thing that I have to say is that sometimes when patients have pain in the heel, especially after starting a running program, without having any prior experience of running, or maybe you're starting a program in a bit too intense phase, is the possibility of stress fractures, as I was mentioning in my talk. So, it's been quite common. I've seen quite commonly some patients with stress fractures of the heel bone, and they actually didn't know they had a stress fracture, but what they feel is that the pain and it's not getting better. It's like even after rest, it's not getting better. So if you have something like that, I would say that it's good for you to actually get it assessed soon, because, we just want to make sure that you don't have a fracture. That's the most important thing.
Okay, sure. Thank you so much.
Thank you.
Okay, Anand, we have one final question,
sure.
And then we can wrap up. This is from another one of our runners, Vijayashree. She's shared that she's actually bow-legged and has had 2 dislocations on the same knee with some damage to the knee ligaments. She says that, all of this has, developed a phobia for her, jumping over objects, for instance, because she's worried that the impact will cause another dislocation on the knee.
Okay.
So I think her question is, given her condition, the bow leg and the prior dislocations on the knee, what can she do? I mean, she at the same time, she's also keen on continuing to walk or brisk walk or jog and so on. How can she go about still leading an active lifestyle?
So yeah, Hi, Vijayshri. Hi.
Hello.
So, when you say you had a dislocation of the knee, do you mean a dislocation of the kneecap?
Yes.
Yes. Okay. So, dislocation of the kneecap, right, is something that can happen because of a misalignment of the knee joint, as you have mentioned or you have said you have. But what I could say is that how you can prevent this from happening again is actually through muscle strengthening, because you see your kneecap, right, is in a center of the knee, and on either side of the kneecap there are actually muscles. Now I believe that your dislocation was probably on the outside of the knee, so the kneecap went outside.
Yes.
Yes. So what you need to do is you need to strengthen the muscles that are inside the knee, and this group of muscle is called the vastus medialis oblique muscle. VM, we call it VMO muscles for short. And you can strengthen these muscles, and that would actually cause your kneecap to track more into the center, and you will probably not have another dislocation again if you keep on making these muscles strong.
Okay. Right. Thank you.
Yeah.
Thank you very much for that. Yes, I'm actually going through therapy as well. But
Yes.
yeah, I realized that I do have a fear. Simple thing as jumping over stones at the beach is
Yes.
something that I really fear because of the dislocation. So
Yes, that's right. So you see, there's probably a possibility that you may have lax ligaments, which is something that maybe runs in a family. Lax ligaments, because I see a lot of patients with easy dislocations of the shoulder, easy dislocations of the knee, easy dislocations of or ankle sprains, and a lot of them have one similar condition we call it global ligamentous laxity, which means that the ligaments they're more lax than tight. So how do you treat that? Essentially, the focus needs to be on strengthening. So it means that if someone needs to probably do maybe 1 time a week in the gym, you probably need to do 2 or 3 times a week in the gym to actually be stronger. You need to maximize the potential of strength that you have. Yeah.
thank you so much for that. I'll definitely look into that. Thank you.
Thank you. Yeah.
Okay, Anand, thank you for taking all the questions. Again, as I said, I'm just mindful of the time. I promised everyone that we will finish this in an hour, but I think it's been a lively session, Q&A. We've overrun by about 10 or 15 minutes or so, but I think that's fine because there were questions and and those were adequately addressed by you. I think some of the runners have actually on the chat requested for you to share your social media coordinates again,
Sure.
so that they can follow. I think maybe after this, you can on the Facebook page just share your Instagram and Facebook page details, so that they can follow you and follow up if need be as well.
I will do that.
Okay, so I wanted to say thank you for your time. I just wanted to see if Coach Ghana is on. He's on as well. He is one of our elder statesmen. He's a running coach himself. So I just wanted to see if he was on and had anything to say to wrap up as well.
Thanks, Ramesh, and thanks, Dr. Anand, for coming on board to really explain the way of running and all that. One other thing I'd like to add on is the running gait, because you recommended that you would heel, and because some of them run over pronate, under pronate, and all that. So one shoe doesn't fit all.
Yes.
So one has to try, of course, like Maithili was saying, cushioning, barefoot running, and all that kind of thing. So each individual have their own gait and the cadence of running. So I just hope that they all know what suits them best and how are they going to run better and enjoy their running. That's all I got to add on. Thanks again for coming on board.
Thank you.
Okay, thanks, Anand. Thanks again for your time. If you can, as I said earlier, if you can just share your social media coordinates again, we'll be most grateful.
Thanks. Thank you.
Okay, thanks everyone. Thank you. Have a good rest of the Sunday. All right.
Thank you.
Take care.
Thank you.
See you.
Thank you, everyone.
Bye. Thank you. Meet again. See you. Thanks, Ramesh, for organizing everything. Thanks.
Cheers. Take care, everyone.
Thanks, Doctor. Bye-bye.
Thank you. Bye.